under screening of disease. So first of all, what is screening? Screening means we have to filter out. Filter out who? We have to filter out the people who are having the disease from the healthy population. That is called screening of disease. Okay. So by understanding that simple concept, we will venture out into our big ocean. Okay. The ocean of iceberg phenomenon. Okay. In our ocean, we have this beautiful iceberg. So iceberg, we already know, we have already seen in our childhood from a movie. Okay, so Titanic, what happens? How the Titanic sank? The Titanic sunk by having a by going and hitting a hidden iceberg. Okay, because the spotters on top of the ship, they only saw the small portion on the above the sea level, but they were unaware that it has a large portion below the sea level. Okay, so similarly, the people who have the disease, okay, only a small portion of the people will be having symptoms. Okay, so they will be coughing and they will be showing symptoms. Okay, they are the symptomatic cases. Okay, so only these symptomatic cases, they are seen by our doctors. Okay, the doctors sees these symptomatic cases and they treat, but we are unaware that it has a large people who are asymptomatic. Okay, these are the asymptomatic cases, or it is also called as subclinical cases. Okay, subclinical cases, and they are also called as carriers. Okay, so these are the people who the physicians do not treat because they do not see, because they don't show any symptoms. Okay, so they don't go for the doctors, and the physicians, they won't see. Okay, the physicians don't see. Here physician sees. Okay, so what we have to do now? Okay, so our hidden part. Okay, this is our hidden part. So they are hidden among the water, the rest of the water. So what the rest of the water will be? These are our healthy people. Okay, these are our healthy people. Okay, from this healthy people, we have to find out this asymptomatic people by a specific test called as screening test. Okay, so it should be employed to all the people who we may think at a healthy people, but they will be showing a symptom. So some of the screening test example are random blood sugar, and one more important screening test we have already seen, Mantox for TB. Okay, so these are some of the examples of screening tests. So what we have to do for symptomatic cases? Okay, for symptomatic cases, they are already showing symptoms, so we have to confirm they are already coughing. So whether we have to confirm whether the cough is due to TB or the cough is due to any other opportunistic diseases of HIV. Okay, so that is called as a diagnostic test. Okay, so having said that, there are some diseases which don't show. Okay, we have already know that most of the phenomenons, they show iceberg phenomenon. Okay, but some the disease which don't show iceberg phenomenon. Our disease will not show iceberg phenomenon. Think of it. Okay, so for a disease to show a iceberg phenomenon, there has to be a large gap between the onset and the onset of symptoms and the entrance of the disease. Okay, for imagine a person is going to have HIV and then he is going to have symptomatic AIDS. Some people, they have years together of incubation period. Okay, but some and also our NCDs, most of our NCDs, we may be obese for so many days, so many years, but the risk factor has already started. We are already having increased cholesterol in our blood, but the symptoms comes after a age of 40 or 50 say. Okay, so most of our NCDs, non-communicable diseases like hypertension, diabetes mellitus, Okay, our sexually transmitted diseases like HIV, okay, HIV, syphilis, okay, and our one of the most important diseases, those are carcinogens like cancers. Okay, so all the onco diseases, they have a large period between their onset entrance into the body till the point of showing the symptoms. Okay, so the time period has to be very short in the diseases which don't show the iceberg phenomenon, meaning if a virus is coming inside your body, it has to show symptoms. For example, we have our rabies, because rabies, once it enters the body, it will surely show the symptoms like hydrophobia and so and so. Okay, so the incubation period is very short, and that is 100% chance that 100% sure that the person will elicit a disease. So there is no hiding, there is no hidden part. Okay, all the people who are having the disease will show their symptoms. So that is our concept. Another thing is tetanus, our measles and rubella. Okay, these are our four major diseases, okay, which do not show the phenomenon of iceberg. Okay, so the next concept is we have seen two tests. One is screening test and another is diagnostic test. Okay, so what are the differentiating part? Because one of the important NEET question has come in this differentiation. We will see the NEET question afterwards. First, we'll go for the description. Okay, so the screening test will be applied to the ocean of the people who are healthy. So it is applied to a healthy people. Okay, healthy population, and it is applied to so many people. Okay, because we don't know which people are having the disease, it is applied to a group of people. And then, so the result should be, how the result should be, the result should be very very simple to interpret, and it is should be easy. Okay, and it should be also the final result, only one result should come and it should be the final result. Okay, if the result is positive,